Folks, welcome back to another episode of the I Am GPH podcast. Today we have an exceptional guest with us. It is Nate Maxey. Nate is a biostatistics student here at NYU GPH whose career path reflects how versatile and transferable your public health skills are and even could be for each and every one of you. From contributing to New York City sodium regulation research to unexpected turns working with Beats by Dr. Dre and analyzing legal policy, Nate has applied his data and research expertise across a variety of industries. Through programs like PQAR, which a lot of you have heard about if you have tuned into this podcast before, and a range of research assistantships and fellowships, he's built a dynamic portfolio that speaks to the power of public health in shaping the real-world impact that we see out there. Can't wait to talk to Nate. Nate, welcome to the IMGPH podcast.
Hey, nice to meet you. Good to have the opportunity to speak on my research and stuff like that. Thank you for inviting me.
I mean, it's more than your research, you're getting started with the research, but really, I think you as an individual is what fascinated me the most. I'd love to hear that one point where the public health journey even started for someone like you.
Oh, man. I feel like a lot of scientists I met stumble into public health and stuff like that. For me, I used to be pre-med a long time ago. My parents told me like doctor, lawyer, or engineer. And I was like, I picked doctor. So I was a biology major at Cornerstone University. And it was cool at first and everything like that. But then one day I took a few math courses. I was like, this isn't enough math for me to be like a doctor. This doesn't make any sense. So I went to the math department and I asked him, I was like, you think there's any good math course you should take for like a pre-med? He was like, yeah, you should take like calculus and other stuff like that. Well, my friend, Dr. Devereaux, he's over the math department at Cornerstone University. He was like, add a math minor. I was like, a math minor? Why would I do that? Like, what am I going to do with that? He's like, you can use math for everything. So I decided to like add the math minor and take calculus 1 my first year. I loved it. And then ended up falling in love with mathematics over medicine. And then I was in this conundrum, like I'm a biology major with a math minor. What am I going to do with this? So I started doing a lot of research and I found out about like biomath programs, applied mathematics, and biostatistics. And that's when I started like contacting researchers and other statisticians in industry and just trying to like network with them. And they told me about, I think it was StatFest 2021. And I joined the conference and they're like, yo, like, just go to this. I think you'll like it. I liked the conference. I networked with a few people. Even though it was online, I didn't get to see too many faces. They sent me a few, like, they call REUs, but they're like undergraduate research opportunities. And they told me to apply for NYU PQAR. So I applied for it. Just put it in the air. I had no idea if I was going to get in or not. I ended up getting accepted. And then I was like, like, I got into this biostats REU of like, I don't know if I'm ready to apply to graduate school or not. And my mom was like, you should also apply to NYU's graduate school, because it was around like my senior year. I was like, NYU, I'm not going to go there. Like, what are you talking about? I ended up listening to her and applying to their graduate school and getting in. I was like, and they gave me a decent aid package. So I was like, yeah, let's go to NYU. So I tried the REU. It was really great. I met some good opportunities networking like Dr. Patinsky, Dr. Shu, met Dr. Goodman. I met just a variety of different researchers. And I kind of fell in love with it. And I was like, this is something I probably could do for long term. And after the program, I decided to come to NYU for graduate school. The REU was in the summer of 2023.
Was it REU?
That's the undergraduate research opportunity. It's PQAR.
PQAR is called an REU. No, it's all good. So PQAR is called an REU.
Yeah.
Okay.
Yeah, and a bunch of universities have a bunch of REUs. But that was the one specifically I got into. I fell in love with it and decided to come here and move to New York for graduate school. So
how did the people in your undergrad degree know about PQAR? Like what even beyond them, like how do they know to guide you to this place?
Well, they kind of didn't. They were like, I was just talking to them about graduate programs and they're like, I don't know, maybe applied math or... Yeah, it was more applied math programs they were trying to gear me towards. But she's kind of like a second mom to me. Her name is Dr. Lakeisha Turner. She's a PharmD at Eli Lilly. And she was like, I called her too, like an undergrad. I was like, I don't know what I want to do. I have this biology degree and this math minor. What should I do? She's like, let me connect you to my friend Brian Millen, his name's Dr. Brian Millen. He's a statistician at Eli Lilly at the time. I think he's at Biogen. But I talked to him for like 2 or 3 hours about statistics. And he was like, I think you should go look into biostatistics. And I was like, all right. All right, I'll look into it. And he was the one that told me about like StatFest and everything. So it wasn't directly my faculty members. They showed me they convinced me to add this math minor, and that's how I fell in love with math. And then from my own network and some family friends, they told me about biostatistics, and I ended up trying to choose that journey. But coming back to it, I kind of stumbled into it, just taking classes, trying to figure out what I liked and what type of scientist I wanted to be.
So I love how you've gone into pre-med and then now you've actually become a statistician in a way.
Yeah.
So for those of us that don't know, what is biostatistics? How would you even describe biostatistics to us?
Okay, so when I first started, I used to just say it was a math behind public health. But after taking courses and everything, you take data and you learn how to tell a narrative with it, with different stakeholders and stuff like that. So basically, you're a storyteller, but you use really complicated math and stuff like that to communicate it.
That's pretty simple. You're a storyteller who has the data, but is actually storytelling the data, simplifying complicated numbers into a story.
Yeah, because I've noticed that when I talk about math with people, they might tune out, but if I can tell a compelling story with it, connecting a little history, something that they might resonate with, and then incorporate the empirical analysis and give them the high level stuff, a lot of people are convinced with different research and different studies sometimes, depending on the person and the stakeholder and stuff. But it's just learning how to use or make data-driven decisions. That's what a lot of statisticians do.
What about the kid right now in high school that's maybe watching this, or someone else that's thinking about what they want to do in the future? Why would you say biostatistics is important to the world of public health?
Man, it's the foundation of research and policy. You need empiricism to back your arguments most of the time. There's a beauty in qualitative and quantitative research, but focusing on like quantitative stuff, like you just need numbers to back your argument, and people listen to numbers. I think a lot of people say that, like, the numbers don't lie. They can, but I think it's just something that people see math as a way of objectivity, and I think that's what statistics is to some people.
It seems like you're aligning on a common theme of math and biostatistics. How did all your opportunities, I'd love for you to talk about the opportunities, the fellowships, the assistantships, the other jobs that I even described in the introduction for you. How did that all get started for you?
When I was an intern at PQAR, we had to take a few courses, a course in biostats, epidemiology, and statistical computing. And we had 3 different instructors. So my biostats instructor was this guy named Adrian Harris. He's a really cool dude. He was actually like my first black math teacher. And I really resonated with him because I was in the military for 6 years and he was a Marine. And I decided, I was like, hey, I really liked your course. Are you doing any research this fall? I'm coming in as a graduate student. And he was like, yeah, I definitely have a paper I could hop on. So this is like my first opportunity. It wasn't a paid opportunity, but he taught me a lot of data analysis skills and other like soft skills that I didn't pick up over the summer, but really helped me and translated to some of my coursework in like statistical computing. After I finished a project with him in around like May, I hopped on like a few papers in the Center for Anti-Racism, Social Justice, and Public Health, working with Dr. Bather. He wanted to be my advisor for my thesis. So networking with Adrian kind of got me connected with the center. And then I started another paper after working with Adrian, and that was the sodium warning regulation research that we were doing. I was working with that research over the summer, and I was interning at Regan Street doing bioinformatics research. After the paper was still ongoing, and after my research ended at Regan Street, because it was only like an 8-week internship, I decided to reach out to some like faculty, like Dr. Silver, because she was on the paper I worked with Adrian. I was like, hey, I see some positions, and you guys are doing like policy analysis and looking at like ERPO coding and stuff like that. It was her. It was Dr. Silver and Jean Bay. And just working with Dr. Silver and making the connection with her through Adrian, they gave me a position to do the ERPO coding and the policy stuff. So that's how I kind of got geared into that. It was kind of just going from door to door, working with people. Another opportunity opened up, and I decided to take it. And like all my unpaid opportunities ended up turning into a paid one, from like networking with all my profs and really just building relationships. And I tell people this, it's not like I'm like their best friend or anything like that. It was just stopping by, asking them how they are. And like, if people can work with you and they see that they're personable, they'll look out for you and put you on other projects and stuff like that. So it's like a combination of like being a people person and also working hard at the same time.
Yeah, tell me more about that, because there's no denying that your hard work is present.
Yeah.
And you know your stuff. At least even talking to you, you have simplified biostatistics for me, and I know nothing about biostatistics. But what I admire is how you mentioned at least 10 names in this past answer you gave me right now. And beyond being a people person, how could you simplify the art of networking with people in this field?
One thing I learned from New Yorkers being from the Midwest is being real. And you have to be your authentic self, be confident in that, and also learn how to be cordial with people, but like keep it at a professional level. And that's what I did. It's just like I tried to gear my relationships that were towards research, but then also wanted them to know as a person that like I'm still looking out for you. And I think that's what networking is kind of getting rid of that barrier in your mind or division between you and that prof or someone you want to work with, and just becoming one in community. And that's what I do with my networking situations. I try to become friends with them, not like they're my best friend, but more on a friendship as a professional level, if that answers your question.
Yeah, can you give me an example of that? Like, is there a story you have where you kind of figured that out, or a time where someone you didn't know became more of a good acquaintance, you collaborated with them on many projects?
Here's an example. My friend Fabiola, she's in the same cohort as me. So when I first met her, she was really quiet, and I was like, I'm gonna reach out to this person because, like, I don't know. I felt alone coming into this cohort, so I was gonna talk to them. And we worked on our first project for, I think it was psychometrics. No, it was regression 2. And after working with them, they had a really good workflow. It was really easy, and like the project, we started a little bit earlier, but we ended up doing really well on it. So I was like, hey, this is the person I could work with and I'm looking out for. So outside of the schoolwork, it turned into a friendship. So we would send each other like internships. If she was confused, or if I was confused on a paper or a project or something like that, we'll send each other videos back and forth. So it was really just looking out for each other that we understood we could get through this coursework. And then other projects, like in psychometrics, I worked on a project with her. I'm trying to think what else. Oh yeah, and then in regression 1, also I worked on a project. So it started out from like a simple friendship and just reaching out, and then just helping each other out over time, and we became closer people. So that's how like I decide to pick people on my projects. I start with them, and if we can build a friendship, then I think I could work with them long term, because I can learn their working style, they can learn mine, and then we can get the job done.
It seems like a collaborative authenticity that you're speaking of. Everyone's connecting on a similar thing, but you're being honest with what you can offer and who you are at the same time.
Exactly. So I'll just being real upfront about the stuff, because if people are real and upfront, it's easier to tackle those problems and get those hard deliverables out there, versus like if people are afraid to communicate with you, it's kind of hard to get past problems because they're afraid about your reaction rather than actually the work at hand.
I'd love to hear about the other work you have done in the legal world, and even there seems to be some branding things that you have done in your work as well.
Okay.
Is it all biostatistics oriented? Does it stem off biostatistics, or it's a separate industry altogether?
I think one thing about biostats is that it's not always math. It teaches you a lot of problem solving skills, so it can translate to a lot of places. So let's talk about the first one. My internship was Beats by Trade. It was a marketing internship. It was doing research for over-the-ear headphones, because there's been a resurgence of those versus like earbuds and stuff. And I got into that internship. I found it on Handshake, and I was like, I need to get better at the qualitative skills, because I'm taking all these math classes and I'm on the quant side, but what's the qualitative stuff? Because it'd be good to have some experience doing that, just seeing what industry qualitative research, just in case I needed to do it for myself. So they taught me a lot of interviewing skills, like they gave us a whole sheet on how to interview people. I think I interviewed like 20 people during the summer about over-the-ear headphones, and then I had to transcribe it using Otter AI, which is like a transcribing software. And then I took all the data. I had to read through everything, and then looked at all the themes, and then present like a deliverable to the Beats executives about what's the reason for the resurgence for over-the-ear headphones and why it's so popular. So it's taken a lot of talking into high-level ideas and translating it to stakeholders, and I think that's important, again, of telling a narrative with data. And it doesn't matter if it's a CEO, somebody on a board member at a hospital. It's just trying to tell a story with data, and you need to practice that, even if it's qualitative or quantitative. And that's why I pick Beats Well, they kind of picked me, but that's why I wanted to do the internship. Yeah.
And tell me about the legal work as well.
Okay, so with Dr. Silver and Gene Bay, they were looking at ERPO law. So basically, ERPO law is like if someone's at high distress, like it's really to prevent like school shootings and stuff like that. But if they're high distress, you know that they have a weapon, you can call the police. I think it's like 22 different states, and they'll come and do a wellness check on them, take their weapon away and stuff like that, just in case to figure out what's going on with this person. So to prevent like a fatal shooting, a school shooting, or just some tragedy that we don't want to happen. So that's the reason for ERPO laws. The reason why each ERPO law came out, like in Indiana, I know is due to a police officer dying, but it just depends on each state and each one. Not every state has it, but more of them are getting ERPO laws over time. And what they wanted me to do was to read penal code. So I was working on a team of like 3 or 4 people, and we were just reading legal documents and making a data set and comparing it by state for them to do analysis that Gene Bay wanted to do. So it was really cool to work with like other qualitative research, learn the legal terminology, and that was like a puzzle for my brain. But I enjoyed it. I learned a lot from the opportunity.
So it seems like when I was learning about you before you even came over here, there was a lot about transferable skills and taking one skill to the next, because oftentimes in public health we feel like public health, a common sign, I saw a sign when just coming to the studio today in the lobby that said public health is everywhere, what's your choice in public health, something along those lines. It seems like everyone in public health does one thing, but they also do everything at the same time. So for someone like you that's worked at New York City sodium regulation research, you've done work at Beats by Dr. Dre, you've done some legal work as well, you're a mathematician, but you're qualitative, and you have this networking thing. How can someone go into this world of public health with their transferable skills? How can a public health individual even view themselves?
Don't think that you're only limited to one skill. I think one thing that's important in public health is to learn how you learn. I think Dr. Goodman told me that the most. Because if you know how you learn, it's easier to pick up other skills that can be transferable to your field. I think it's a complication of like Western individualism, but a lot of people think in silos with their skills, but every skill is transferable to each other. You just don't know yet. If you ever watched Pulp Fiction, there's a lot of unknown unknowns out there. You don't know what skill you're going to use that for. So I always tell people that keep your mind open, and that sometimes even a skill that might not relate to your field could translate to something else. Like an example is machine learning. Like that's changing the game in the world and how we predict things. But at first, like machine learning was like something in a silo, and it was just somebody's paper or something like that. Yeah. Just know like any research or public health research you can do or any other skills will be and can be transferable. You just haven't seen it yet, or you just haven't been on a project where you haven't had to use it. So I tell people just keep open-minded in that you'll be picking up skills and you'll constantly be learning over time.
So all you're suggesting is that we all have the ability as public health students, and we just need to keep reiterating that, kind of sharpening the tools again and again, and going back into the field, it seems.
Yeah, because every project you work on, you'll pick up a new skill. There's always something that you'll learn from a research project. It might not be something that you might see that's applicable right now, but it might come back later on in your career. You have no idea. Like no one can really predict the future. So
speaking of future, let's talk about your past.
Yes.
I'm just kidding. So you worked in, I know you mentioned how you landed the New York City sodium research gig that you had, but let's go back to how you landed it and what did you learn from working there?
What I learned from Dr. Bather, it was a lot of things. He was my advisor for this paper. One, he told me is that writing is really important. What sets statisticians apart is how you write and communicate. If you can't tell a compelling story and present it, people aren't going to listen to all your complicated models or how smart you are. So it comes back to having a little bit of charisma and also knowing how to communicate really well. So he really hounded in on my technical writing skills and stuff like that. I tell any public health person, always look over your writing, go to the writing center, have somebody look over it. It doesn't hurt to have second eyes. And that's something that I really learned in graduate school. Like writing's really important. And also too, paying attention to detail. People don't like to repeat themselves, and it's okay to make mistakes, but always try your best when you're working with PIs to dot your I's.
What's a PI?
Principal investigator. I'm sorry for using acronyms. To dot your I's and cross your T's. It's really just pay attention to detail, because that would make you stand apart also. But those are two things I learned about working with him, is that the professionalism of just making sure you check all your boxes, and also that make sure you write clear and that it's usable and it's has some compelling story with it, because that's the way you're going to set yourself apart from other scientists and statisticians.
So how did you get good at that?
Oh man, practice. Like, I had to shoot. When I first gave him my first revision, he was like, go to the writing center. I went and they gave me a lot of feedback. And then from there, all the feedback they gave me for each revision for my paper or something else, I wrote it down. And then like every morning I would write like maybe 200 or 300 words a day, journaling about my life. But I try to incorporate some of the stuff that they gave me or any of the feedback. And that helped really tailor my own writing style and really get me better and become a better writer as a graduate student. But it came down to practice. So you just got to do a little bit every day.
What were your findings at perhaps the sodium regulation gig that you were doing? What did you, beyond the changes inside you as an executor,
yeah,
what did you notice? What did you learn about that industry that we would be surprised about?
See, there's always a limitation to the models that you use, and that even when you find decreases, there's a thing in stats. There's always associations, but not causation. That's a thing in science that people worry. What causes what? And there's a lot of stuff that's associated. So when you write a paper, you're gonna find associations, but if you really wanted to find the answer to the problem, you have to continue to study and repeat it. So I've learned that even with the models that we use, like, you're gonna find a lot of red flags for problems, and that later down the line that you're going to have to be the person to solve that problem, or somebody later on who does it. But it just depends on your motivation and what time that you actually have. So that's what I've learned from this research, that a lot of these like a lot of these cross-sectional studies or stuff over time, it's a continuation of another study to try to figure out what causes what. But the limitations of science is that we can't actually say what causes what sometimes. It's a whole thing of causal inference and everything. So
okay, then where do association come into that again? I'm trying to understand.
Well, to be clear, that the models that we use there's a lot of associations that we look at, but they don't actually tell what causes what. So it's a red flag to continue another study for that same type of paper.
So they're certain about it.
Yeah, because the scientific method is big on a repeatability and just doing it over and over again, and then you could probably come to a conclusion of what causes what. But this one paper isn't the tail answer to everything, but a red flag to see, what's causing this, and maybe we should try to study it the next time. So that's what I've learned from doing the research, especially this quasi-experimental study.
So what's a process for us to get more thorough in these complicated issues that exist?
I think there's a big data revolution coming on, so it's collecting a lot more data, but then there's going to be a trade-off between your own private data and living in like a surveillance state and everything like that. So I think we need to collect more good data on about health behaviors, but there's a trade-off between if people actually want to give up that type of information in the world. But it just depends on the person, yeah.
Do you see a role of AI in public health?
I think it's going to change the game. To be honest with you, I think we're on the brink of world-changing things, especially with large language models and everything like that. You can use AI a lot to predict things or to help people. So I think that it's going to be the future in the way that we lead science and stuff like that, especially in public health, because we're really big on trying to predict and trying to prevent downstream and upstream problems and stuff like that.
Well, explain that a little bit more. What is a downstream and upstream problem?
Okay, so think about this. So think about a river, and you have people falling into this river. So like physicians, clinicians, they deal with the downstream problems. They pull people out of the water, fix them up, and then keep them from falling again. Public health is wondering, why do people even fall? So I think that it can help clinicians pick people up out of the water and treat them better, and also think it can prevent population from falling into the water in general. But it comes down to having that data, and sometimes that can be expensive to get.
There's a lot of hidden wisdom and nuggets in everything you're sharing. I know you mentioned a lot about mentors and networking and everything, and even the future of AI, but what excites you for your future?
One thing I love about education is the way that a degree changes your worldview. Because the way I looked at problems from an undergraduate was a lot different from a biology perspective. And then now, about to graduate my MS in biostatistics, I look at problems way differently than I did 2 years ago. So I'm really interested to see in the future when I start my PhD this fall, like how my brain's going to change and look at problems and the way I tackle them. And I like that because I'm constantly learning. I think lifetime learning is a big thing for me. So I'm excited for the lifetime journey of just being a student.
The time we're shooting this episode, by the way, it's around May 2025, and it's usually graduation time in May. But Nate's going to continue to do his PhD at the time we're recording this video. So when you're probably watching it, Nate's doing a PhD at this time.
Yeah.
You're saying you don't have an idea of necessarily a dream job for yourself, but you know that learning keeps happening?
So this is a little history about Indianapolis, where I'm from. Eli Lilly's world headquarters is there. So a lot of scientists try to get a Lilly job because it pays pretty well. There's a lot of good benefits and a lot of people are happy. So my goal is to be a statistician at Eli Lilly long term. But we'll see where life can change. My research can change. I might have different interests, or I might want to go into academia or something different. You never know depending on what's going to happen. So right now I tell people I want to be a statistician at Eli Lilly, but you never know.
If you could make one data-driven research health policy change in the world right now, what do you think is the important one that strikes a chord with you?
Shout out my mentor, Sean Grannis, add a national identifier to electronic health records. Cause it's like a bylaw in HIPAA that doesn't exist. And with a national identifier, I think people will have the ability to link electronic health records from different systems a lot easier versus what the methods that they have to do now. Cause a lot of clinicians need a lot of data to make a diagnosis and to help people so they don't cause harm or to give them the best treatment. So I think a national identifier for United States citizens for like medical stuff is important.
I can see how your heart struck a chord. You immediately had the answer for it.
Yeah.
I didn't ask you this earlier, but I was curious to know before the interview started. We never got there, but I know you spoke about the interview process at Beats by Dr. Dre, but no one would think someone doing a degree at NYU GPH would be working at Beats by Dr. Dre for a while. So can you tell us that story? How did that happen?
Oh, man. Internship journeys or internship seasons very stressful. Academia is a rejection. You hear a lot of no's and yeses. So I was just shooting out a lot of internships, and I saw Beats by Dre, and I was like, this is really interesting on Handshake. Shout out Handshake. You can find a lot of good internships on there. I think most of my opportunities at NYU actually came from Handshake, or I saw them on there. But I saw Beats by Dre on Handshake. I applied, and then they ended up telling me I got it. And then it was like a month internship from May to June. And after finals ended, I was just doing qualitative research with them for a month. So it was a really good opportunity. It was a really big internship. It was like 200 people from schools across the country. So I still got to network a little bit with different people. I didn't get to talk to too many people because it was online, but it was a good internship for like qualitative marketing research. Yeah. That's how I kind of fell into it, was just searching online and searching for internships because I needed something. I needed to do something. Yeah.
Where you're a quick learner who knows how to pivot very quickly as well in his journey. And I know you mentioned the recognition of identity for people that's coming up, but what about the world of biostatistics and public health is exciting you about the near future as well in general?
I think what's exciting me the most is seeing how they integrate all of these all this data, health data, and how to make decisions for people long term.
Wow.
Because they're collecting. There's this thing in stats that if you have bad data, your model that you're going to use is going to be pretty bad because it's training on something. But we've realized this in that we're collecting better data. So I'm curious to see what health is going to look like long term with all this AI stuff, with the better data and label data that we have over time. I think it's going to change our health outcomes. But I think with the US, there's like a lot of health disparities, and like my prediction is that like it's going to benefit Americans overall, but I think that the people who need it the most not always will get the fruits of that labor.
Tell me more about that part.
Well, actually interesting. So when I was at NYU, I got to read a book about like colonialism and the history of like epidemiology and stuff like that. And the premise of this book was saying that, all the science that we've used today has benefited people who are majority in power, whatever system that it is, and it has not helped marginalized communities and everything like that. Example was, there's a fact that you only can survive with food without 10 days. And as a kid, I always wondered how they figured that out. And they actually learned that through the transatlantic slave trade. So they actually were like statisticians on some of these boats. And they realized that to keep people alive, they had to feed people, but they tried to do it they were trying to conserve resources because they're on a boat. And they learned that people died after 10 days from, on average, from not having food. So it was due to like a lot of history and trauma, but the people who learned about this got to benefit from it, but the people who were enslaved at the time did not get to benefit from those resources. So that's an example of that type of research that they were doing, learning from Black bodies and never translated to the actual African that needed the help. I'm sorry if that's a little deep.
No, it's not apologize. It's fascinating that like I find it interesting how you even saw it from two different sides as well, where the upsides do have downsides no matter what. Either way.
Yeah, that's really important that you have to center marginalized groups in your research, because they're not going to get the benefits of the people. Because think about it, we're in like a weird silo. We get a lot of access to cutting edge research, new health information. There's people who haven't been in school for 20, 30 years and don't have access to this sometimes. So I think about when I do my research, how can I translate this back to the people who need it the most, the people that we study, that they get a small little benefit. It might be a little gift card or something for doing their research, but the research that comes out, they make millions off of, and they never get to impact off of. So I try to do the research for the people, because that's what it's really for.
It's a fair equation, really, the way you're presenting it. Well, I mean, I've asked you everything I'm very curious to know about. Is there anything that you'd like to share with people? Anything that's in your heart right now to share with everyone?
Yeah, for anyone trying to come to NYU or starting a graduate degree or anything like that, there's a few things that you gotta realize when coming into this. One is that you're gonna have to talk to people, and that grad school isn't like an individual game. You're gonna make friends or you're gonna make acquaintances. You're gonna have to work with them, and you're gonna have to work on a lot of group projects. So just know that be ready for a lot of group work, which can be a hit or miss for some people, because not everyone there likes working with people. So that's one thing. And also too is that the classroom isn't enough. You need to actually translate the skills that you're learning into like coding or projects and stuff like that for it to really stick. Because you can do a little homework assignment and feel like you understand it, but when you actually have to apply it in the real world, you learn it a lot better. So that's another thing, is that you really have to apply this work. And then two is that not every research opportunity is going to be a paid opportunity. So just being real, let me count. Let's say if I'm starting from graduate school, when I started at NYU, I did about 3 unpaid internships before I got my first paid opportunity in grad school. And all I'm telling you is this, is that you're going to have to do a little free labor. You're going to have to sacrifice a little bit, but it's going to be worth it, because you need to fill your CV with a bunch of research opportunities. Because think about it. If you haven't worked at all your life, and you're just doing coursework, and let's say it's second year, you're applying for jobs, you don't have any research under your belt. When employers look at you, they're going to be like, what were you doing? Like, where's your research at? And I think it's really important for you to do, even if it's maybe 1 or 2 positions, it could be unpaid or not, that's going to set you apart. So I also got to shout some people out. My homie Nahome. So I worked in the Applied Global Public Health Initiative. It's Dr. Dickey's lab, but I worked under the Mycetoma Project. And Nahome was a project manager at the time. I was a research assistant. Nahome gained a bunch of different skills being a project manager, managing people, doing a bunch of research, public speaking, communicating data-driven decisions and stuff like that. And he leveraged his project manager skill. Well, he gave 2 years of his time, and it was for free. And his job turned into a job at Fred Hutchins Cancer Center in Seattle, Washington, where he's originally from. So he leveraged that unpaid opportunity into something paid that he could talk about and had experience with. Even though it wasn't a corporate job, it was still some experience that can translate. And that's where that transferable skills and networking comes into play, because then you can kind of leverage the unpaid stuff that you didn't get paid for, which can low-key help you out in the future. So I say is that network, put yourself out there. It's okay if you do a few unpaid labs, and that you're not always going to get paid for your work, but it can translate out. But I say don't do this. don't do any research at all and don't apply it, that's not going to help you all long term. And you're going to feel like you wasted your time. So just make sure you network and put yourself out there.
It's very practical advice. And what you're saying about unpaid is like, it's really paid when you put it that way.
Yeah.
Unpaid is actually paid because it's opening up. It's an opportunity. It's a learning. It's a mindset, which you wouldn't get otherwise. And it's almost better than not getting paid because your heart lies in it when you're doing it.
Yeah.
So what's something that people should look forward to? The students coming in, the students that are here right now, the students that even left, like you, who are going to leave soon. What should people be looking forward to when they come to NYU GPH?
Man, I'm going to tell you this. The faculty here are amazing. Please talk to them. They're really cool people. They know their stuff. They're really established in their field. And I think it's really important that you foster that connection, because if they know you, they'll look out for you. But if they don't know who you are, you never came to class, never talked to them, they really can't help you. So really put yourself out there. I say that. And look forward to like all the like fun events GPH has. There's a lot of affinity groups you can join. You can really find your people. GPH is a very diverse community. And then also you have the city to New York. So this like the balance out having fun in New York and also having fun in GPH, but also work hard and try to network. And I think you could really maximize your opportunity where you feel like you didn't waste your time just only doing school, but you also gonna have a good social time at the same time, because you need to work hard and play hard. No one just works 24/7. We're not robots. So,
well, Nate, really appreciate it today. Thanks for all your insights and amazing things coming for you in the future.
Thank you. I appreciate that.
Pleasure. Folks, that's Nate Maxey. Track his journey, and I'm sure there's a lot of words of wisdom for all of you over here. Thanks for tuning in. We'll see you in the next episode. Take care, everybody.
Peace.